welcome to The Big Question. We are here today filming at the historic and amazing Matrix Music Studio. And today's big question is all about cosmetic surgery. And joining me today, I'm so excited, thank you so much for joining me. We'll start at the end. We have got cosmetic doctor and trainer, Dr Chike. We've got activist and model, Talulah. We've also got activist and model, Rain Dove. And on this side, we've got singer-songwriter, Miss Kay. Here today to talk about cosmetic surgery and the pros and the cons. We're going to start off talking about cosmetic surgery. There's been a massive surge over the last few years, probably actually over the last 10 years, in cosmetic surgery. And one of the sort of pinpointing it down has been towards reality TV and social media and influencers. So I'm going to start at the end with Dr Chike. Have you noticed a difference since social media has been around?
I think you're right. I think social media is massive in what I do. I'm an aesthetic doctor, and I see that really has pushed people towards, what I do, which is non-surgical treatments. So facial aesthetics, Botox fillers, that type of thing, skincare, and yeah, that's been a massive driver. And what I'm finding is that people are sort of seeing reality TV stars. They're more open about, what treatments they're having. And, it's not even in this country. You have to look in America. You're talking, the Kardashians. They're the ones who've really pushed it.
They're the biggest.
Absolutely, absolutely. Without them, we would, we'll still be way behind. It's because they've pushed it forward, and literally people see it as something that they can aspire to. So yeah, I think that's been massive.
And everyone else, where have you, when you first became aware of how easy it was to access cosmetic surgery? And
well, for me, obviously, because I'm transgender, it's been a lifesaver for me. It's given me the option to create who I want to be and how I want to look, because it's always been my dream to be a woman. So having cosmetic surgery has given me that option to create that dream. So for me, it's been a lifesaver, otherwise I'd have always felt like, and so it's given me the confidence, having filler, and I mean, I've had no actual surgery on my face. It's just been like, non-surgical, the fillers and the Botox and stuff like that. But I guess down below is kind of still a cosmetic procedure, right? Isn't it?
Yeah. Surgical,
but down below. And so having that surgery, my vagina surgery, that changed my life massively. It gave me the opportunity to put F on my passport. And do you know what I mean? It just changed my life so much.
Is that from a mental health type thing?
Yeah, mental health and in terms of certificates, a lot of people won't identify you as a woman unless you've had the full surgery. So surgery in general, cosmetic and just normal surgery, has given me the option to be who I wanted to be all along. And so for me, it's been a lifesaver.
Have you noticed that there has been a slight change in people's attitude towards cosmetic surgery? And when you were growing up, was it something that was very spoken about and you felt very confident to go and talk to people about?
No, definitely not. No one used to talk about it growing up. Like everyone used to have really thin lips. Everywhere. Now it's like everywhere you go, it's like, do you know what I mean? But when I look at old photos, but we're naturally blessed with the bigger lips anyway, because of our melanin and our collagen, and that's naturally in our DNA. So, but that's an interesting point of view.
No, you're right. You're right.
An interesting thing, because obviously without stereotyping, black people naturally have bigger lips, bigger bottoms, and just more bigger everything. And now it's funny how everyone wants that. Do you know what I mean? Like Kim Kardashian with the big bum and Kylie Jenner with the big lips. Everyone wants bigger everything, and now it's become a trend. Our culture and our DNA has now become a trend, and it's strange how it's become like that. Obviously, for me, it's all about my identity and my gender identity, But for a lot of people, it's to do with the trans. Some people, it's to do with the race. Like, you know, we naturally have that in our DNA.
But going back to what you're saying, like, you're right. People didn't talk about plastic surgery.
I disagree.
Yeah.
I'm from Colombia,
Yeah.
and while social media may have raised the visibility of injectables, plastic surgery has always been prevalent in places like Brazil, Colombia, South Korea. These places are the mecca of plastic surgery, and it would be very uncommon to actually find someone who hadn't had a boob job like I did, and this was back 10 years when Instagram wasn't even on the radar to raise the profile of these things, and it had nothing to do with imitating a race or anything. For me personally, and why I'm here, is because I had plastic surgery and I've had injectables like Botox and fillers, and I got a horrendous complication of breast implants that no one spoke about at the time. And I didn't get it because of trends or anything. I got it because of my own insecurities. I would look in the mirror and I saw an asymmetry that no one would notice, only me. And it's in my head, like most of these things are. You know, you see the thing that you really need fixed, and then you'll be perfect, and then you look wonderful, and then you'll feel good. But it's in your head, other people don't perceive you like that. So yeah, I think plastic surgery, and maybe not injectables, were very, very visible way before any of these trends. I think injectables are way more available to people.
Because they're cheaper.
Because they're cheaper.
Yeah.
And you do see people like the Kardashians who have made it, you know, some of them, they look amazing. No one can deny that. Whether it's fake or, you know, real, that's a different conversation.
So did you have a boob job and then had them removed?
Yes.
Why don't you tell
I have
us
them right here.
Oh, wow.
Yes. I brought them
So
here.
what was
Ready.
the-
You were
what was the
ready for
reason?
this. Yes.
What was the reason for you having them removed?
Please let me tell your story, because it's quite, I think
Well,
it's something
it's-
that needs a bit of awareness around.
Well, I'm going to condense 10 years. So I was 19 and I wanted a boob job, and I went to the surgeon on Monday and I had it done on Wednesday. So it was a very quick thing. I didn't really do any research other than the complications from the surgery itself. So an infection, or, you know, they won't look the way that you like. You might not be happy with the size, and those were complications that I could live with and that I was well aware of and that I was made aware of. But no one tells you that you could get something called breast implant illness, which is your body simply cannot have a foreign object in there, especially not one made of silicone and something like 40 other...
So it wasn't discussed at all?
No, but...
Okay.
I've never heard of this.
Yes,
What
most
is it,
people
breast implant
haven't.
illness?
Yes, and I don't blame the surgeon, because a lot of them are not aware, because it's the manufacturer and the way that these things are approved in the US, for example. They leave it up to the manufacturer to prove that they're safe. And of course, these studies are biased. They're only done with a couple hundred women, followed for maybe a couple months. And I started getting problems maybe years later. So no one is following this up. And we are millions and millions of women sick. And I basically went from doctor to doctor, neurologist, rheumatologist, ENT, cardiologist. And all my tests came back saying I was fine. But I couldn't get out of bed. I was suicidal. I'm sorry if that's a trigger warning.
So it's a bit of like a mental health trigger as well.
Yes, but also very physical symptoms. So I had joint pain. My hair was falling out in chunks.
I've never heard of this.
It's
mad.
crazy.
So you clearly had like immune response to that implant.
Absolutely,
that you had,
absolutely. And because I had never been warned of this, you know, I got migraines and I got vertigo, and again, just I got diagnosed with chronic fatigue, with 0 markers rheumatoid arthritis for a 20-something-year-old. I just thought that it's just
Wasn't right.
it's just
But
so
what
too many
is it about
things.
the implants that makes
So your
your
body
body
rejects
react
it.
like that?
Yeah.
It's a foreign object. So when the implants are put in, your body builds like a meat around them, a capsule is
Yeah.
called. And this capsule is containing the implant, but you know, this thing is made out of silicone, which shouldn't be in your body. And even though my implants were not ruptured, the pathology showed that I had silicone particles everywhere. And this blocks your lymph nodes, and it just causes havoc in your body. Your body doesn't want this inside of you, basically. Now, it doesn't happen to everyone.
What's the percentage? Is it like 1 in 100 people?
We don't know. We don't know because it's not properly studied. I know, for example, there are support groups on Facebook and other social media platforms, which is how I saved my life, really. I stumbled upon this group on Facebook, and the America group alone has over 120,000 women. And it was just shocking that no doctor had ever told me of this. It was other women that were warning others that this can happen, and I took them out and now I feel fine. And amongst us, we know that about 85% of us feel better within the first year, almost completely back to normal after taking them out. The surgeon who performed the surgery here for me did his own study, and out of 100 patients, 70 improved immediately after taking the implants out. So the problem is that women don't associate their symptoms with implants. Because why would you? If your hair falls out or you have a migraine.
What's the worst outcome from leaving them in if you've got this?
I know women who cannot get out of bed. They've lost their marriage, they've lost their family, they've lost their friend, they've lost everything.
From having an implant?
Yes, because they can't afford medical treatment. They can't work anymore.
I think the other problem is it's difficult to diagnose, isn't it?
Correct. Because a lot of doctors who might not be in plastics are not aware of this, like my GP wasn't. And she said, the medical literature says nothing of this. And I was like, well, a couple hundred years ago, we were killing people with epilepsy because we thought they had spirits. That doesn't mean that it's not going to happen. And now the FDA only 2 weeks ago has issued what is called a black box warning. You might be aware because it's also on Botox.
I mean, the thing is, like in my previous life, I used to be an orthopedic surgeon.
Right.
Okay. And we used to do like hip replacements. Okay.
Yes.
And
other implants have problems.
So we used to put total hips, metal hips. We still do. But we learned over a period of time that people got reactions to this foreign body, and they get sort of metal ions, from the implant in their body, and they started becoming unwell. So it's very similar to the picture that you're portraying.
But these are known, so people can be informed
so it's an awareness
before
issue.
they get them.
So absolutely, it's about that education.
Correct.
There.
Say this can happen. Now, if you want to still get the surgery, then it's up to you.
Yeah.
So. Correct me if I'm wrong, but when you originally got the implants, like you were saying, it's a lot to do with your confidence and your
absolutely.
And then actually it affected it completely the other way around.
Yes, it's an immediate boost. You wake up and you look the way that you feel and that you've maybe thought that you should look. And it's incredible what it does. And I felt the same when I had Botox, and I felt the same when I had fillers. And I remember my friends saying, "Oh my God, you look so youthful. What have you done?" And you feel wonderful. And then it made, for me and for millions of other women, it just tanked my health and my life. And if it hadn't been for my husband and my supportive family, I would have absolutely killed myself.
Yeah. It can get that extreme.
Absolutely. And I am lucky that I had that support. Other people don't. So.
But I suppose one could put this in the same vein as, like, let's say you had an infection, that got really bad and you needed to have revision surgery, had to have the implants out. So
but you were warned about that.
Sure. So the issue is the lack of awareness, and something that needs to be.
I'm going to bring Brian into the conversation now.
I'm a person that likes to observe and listen. I like to hear what people have to say, and then I comment. I'm one of those sneaky people.
No, we want those comments. Maybe because looking at your Instagram account, you do a lot of activism towards people being who they want to be in various aspects of life. Do you notice people wanting to have sort of cosmetic surgery and they come to you for advice, and what would you ever sort of say to them?
I have a very different outlook on existence, and it's a very personal outlook. My identity is that I am I, and that's because I want to be determined by my individual history and not the history of a sound, the history of he or she. I want to be held accountable to my own existence. However, for other people, that historic affiliation of what has been helps them understand who they are now and who they can be in the future. I think it's very natural for people to have that primal instinct to be communal. And that's why we oftentimes want to conform or shift our bodies in a way that allows us to find a home, not just within groups of people, but within ourselves. There's this kind of comfort in being able to reflect what we believe is safety. I think when it comes to cosmetic surgery, it's been really interesting because a lot of people think it's a lot easier than they're led on to believe. I've had a lot of, especially trans individuals on my page, who contact me, and they're like 12, 13 years old.
Okay.
This is a warning that's moderately graphic, but a couple years ago I came to London, and a young man tried to cut his breast off with scissors. because he was AFAB, assigned female at birth, and he felt like he wasn't, once he found out how difficult it was to be able to get the surgery that he wanted, he tried to take matters into his own hands. It's a really complicated situation. Everyone has their own relationship to their bodies and to the world. I believe that we really need to educate people on the actual experiences, because a lot of people glorify how great and easy when actually you don't have sensation in these parts of your body, or maybe it's harder to orgasm than maybe at first.
Oh no, I have amazing orgasm. I don't want anyone thinking I don't.
Well,
I have
everybody has their own
sensations out there.
It's good to know. I'm glad.
It's good.
Very happy.
But everybody,
It's all good to know.
everybody has their own
My sex
relationship.
life is very great.
I
We
love
can
it.
take some tips afterwards.
But I mean, it's important for people to understand, but also to be able to make their own choices and to be accepted in those choices. And I think one other thing that's happening, it's interesting because humans have never ever before been able to be as connected as they are now. We used to
Connected
live
to what?
connected to each
Each
other.
other.
Okay.
Social
People
media.
would live
Information
Yeah.
is shared so
But,
fast.
but somehow we're further apart from each other.
Well,
Even though
yeah.
it's easier to be
It's
so
about
connected,
phones.
but we're, it's all
Yeah.
digital, nothing's real anymore, it's not authentic.
But in a certain sense, it can be very real. It's just that we never have had this technology as humans. So there's this, I think that we're in this weird time where, for instance, face filters, that right there gives you a
Distortion.
taste of what it could be like to change your body.
But isn't
So
that
when
amazing though?
it's incredible, but
But
it
it's not
also
real.
It's
isn't
not
real.
real,
It's
but
not real.
it can be real
But
if
your
you go
point,
to the doctor.
Rain's point is
Not
good.
always though, you need to.
And I know that's a bad way
Yeah,
of looking
not
at it,
always.
it
but
allows
But
people
it's
to
an
explore
opinion, that's
explore
it.
themselves.
Exactly.
But then they have these tiny things like a beauty filter.
Yeah.
And what it does is it takes out the little upper lip
Imperfections,
stitch,
Yeah.
little pimples, things like that.
Smooth as your skin.
And it's like we used to be when I was growing up. I knew that models were models. I would be like they were like a whole different species of people. I had a better sense of self-confidence because I knew that I was never going to be that person. But then now everyone has access to that Photoshop, that glassy thing. And when they have to look at reality and they realize that the photos that they have on Tinder have all these beautiful filters on them, and they have to go out on a real date, they have a hard time accepting who they are aesthetically because they know that it might not be the thing that got them that date in the first place. Like it's because we haven't figured out how to apply this
But that's because we
technology.
live in a society where we judge people so much based on how they look.
Yes.
It's nothing to do with using the filters, to do with other people judging you based on how
Do
you
we
look.
think that's new? Because I look back on my childhood and growing up watching films, I had very much an idea in my head of what beauty was, and the things that I didn't conform to, I hated, and I actively, went out of my way to not eat. So I was tiny, which developed then a disorder through it. So now, yes, it's on social media, but is it not just a slightly different way of looking
I
at
think
it?
we're a bit more liberal, this society, and also there's access as well. There's easier access to it. Financially also, and this is the big thing, back in the day, I think plastic surgery was very expensive, aesthetics, but there's more access, it's more affordable, and it's, people see it, and people are looking before and afters, the aspirations.
If you're rich, you can pay to be beautiful.
You can change.
And that's the
That's
sad part
What
of
is
reality.
beautiful, you know what I mean?
Yeah, well,
And
that's-
like
You
also
can pay
like,
to look like
How
everyone's
you want it.
desired type.
And I think
More
it's very,
likely
very
to be like-
interesting.
Yeah.
or less.
What you mentioned about if you're rich, you can look however you like.
Yeah.
There's been
Yes.
studies
Absolutely.
done about how many people have put themselves in debt through trying to desperately look like Kylie Jenner or
Well, they brought up some really good points. One is how affordable it is now, because this is another thing that they don't really warn people about, that is that if you get a complication, which you can from injectables,
You
if
can't
get
afford to
a
have it
vascular
changed.
occlusion and you will go blind, and you could get skin necrosis, which your skin dies and you will never look the same. It is so much more expensive to fix it. To remove the implants, it cost me nearly 3 times more than to put them in.
Yeah.
And that is something, a financial hit that not everyone can stomach. And in the UK, for example, the NHS will 99% of the time not take them out because it is a cosmetic procedure and you chose to do that, right? And like Rain said, it is super important. They do portray these treatments as really simple, like super easy to get, and people need to understand that these things are, as little as they are, they can be dangerous. And it will cost you more to fix it if you don't go to someone who has the proper qualifications, like our doctor in the panel here, and if you go to just like a back alley beautician that will do it half the price, you know, it's just about being aware.
And then goes back to regulation, isn't it? And
Well, let's touch on this because there has been something called the Zoom boom over the last, well, during lockdown really, where people have been doing interviews or meetings on Zoom and have been seeing their reflection or their picture of themselves and deciding that they're not enjoying what they're seeing. So there's been this massive uptake.
I think I'm one of
You're one of them.
No, but do you know what it is? It's because of lockdown, obviously I fell in love right at the start of lockdown. I ended up gaining loads of weight. I went from being a size 10 to a size 14. I've managed to just creep down to about a size 12 now. But yeah, I'm looking at myself in Zoom calls and I'm thinking, you know, I was like, actually considering going to Turkey to have liposuction last month.
No, curves are beautiful. That is beautiful. Curves are beautiful. Like
I know, but sometimes
beautiful.
it's just like when it's a sudden change, especially with lockdown, because everyone's been locked in their houses. There've probably not been exercising as much. They've probably been eating more, and our bodies have changed. You know,
you don't feel good in yourself. Personally.
Yeah, and then it's given us more time to actually look at ourselves. We're in the mirror now more than ever before because we're at home all the time. So and you're bored as well. So you're there looking in the mirror like, oh, you know, I actually kind of want what Kylie Jenner had done, or do you know what I mean? So I think lockdown has actually been quite crucial for a lot of people's mental health and the way that we see ourselves.
I think you're 100% right on that, and as a result, there has been a 40% increase of people going to cosmetic websites.
We've seen it. Yeah,
I mean,
definitely.
But your business is blooming.
Well, it's been interesting. I mean, of course, there was a lockdown, so that we couldn't do aesthetics for 2.5 months or so. And you're right that people have been at home. They've not been able to go away. All right, they've been looking at themselves on the screen, trying to work, finding out sort of things they don't like, or what we call default aesthetics, where they keep looking at themselves and they start seeing things that they've never seen. Okay, so coupled with that, they've got a lot of time, so they can research, they can do it. They're on their sort of Instagram, so, and they're not spending their money, they're not going on holidays, so they've got disposable income. And so we've seen that translate into more people coming through. We've been quite busy from that front.
But there's also been a huge rise in, it's great that people are coming to you through the qualified means. There's been a lot of ads on Instagram for people who are starting to do fillers, cosmetic, non-surgical procedures, and they actually have had no training because they can just order it online. And because you were shut for 2.5 months, there's been a massive increase in this as well, and people suffering as a result of it. Now, just out of interest, as influencers, do you think that's something that needs to be regulated?
Oh, 100%.
Absolutely.
Completely.
100%.
I got an infection from fillers once because the practitioner didn't use gloves. For example, something so crucial. She did not use gloves.
And what was this for? Is it like
and she was a nurse. She was a registered nurse, and she forgot. I think at that time it was Botox. And I just remember thinking, surely she knows what she's doing. And this is one of the things when that I've heard before, and maybe you who have also injectables done, is, well, you chose to do this, almost like we deserve the complication, like, oh, why did you get the implants in the first place? And I absolutely reject that statement. You put yourself in the hands of who you believe or portray themselves as a professional. In the case of plastic surgeons, they take an oath to do no harm. And that doesn't mean that because I want to change my image, I deserve to be harmed, and I deserve to be poisoned, or I deserve not to have the proper care, like putting your gloves on before you perform even the simplest of treatments. And I think it's a really important point, because I see absolutely nothing wrong with getting these things done. I think it's wonderful. If it makes you feel good, go for it, as long as it's not something immoral. and I reject that we deserve what's happening to us, and I reject the notion that I looked for it because I had a psychological distortion of how I saw myself, or that I wanted to feel in a different way. We do not deserve this. I didn't deserve this. Millions of women don't deserve to be sick from this, and it goes with the regulations. Now,
well, there's no regulations.
There is no regulations,
that's
and
the
there
whole
isn't
point.
even regulations for implants, let alone injectables. You know, there's not been proper studies done on this thing that is considered a medical device. So in the UK, anyone can do a 2-day course and inject fillers.
Yeah,
It's crazy.
Yeah.
I mean, that's the problem. Okay, so dermal fillers, you know, so your cheek fillers, your lip fillers, okay, although someone is injecting into your body, it's classified as a medical device. All right, so you don't need, so actually, you know, theoretically, on paper, you don't need to be medically qualified to actually inject these devices. Okay, so Botox is a drug. Okay, so you do need to be, because it's prescription.
Yes.
Okay, and so this is where the issues come in. You know, the whole industry is just not, especially the non-surgical side, is just not regulated. Okay, and so what's happening is you get people doing these sham courses, okay, and they're just literally injecting in the back of hair salons, and you know, no one knows. And of course, if you do something, you know, sort of, you know, if you've got a big following, so you're a beauty therapist and you've got a big client base, you'll treat them, you'll reduce your, you know, you reduce your cost. You're going to do it cheaper. People are going to come to you over a period of time. You're going to get quite good at it. You will.
Yeah.
Okay, so let's say, for example, you're able to get Botox, you know, from someone, and you learn how to do it, you'll be fine at it. Botox lasts you 4 months. You know, if you have a problem, it's going to wear off. You know, so 4 months, you know, 4 months later, you're back to normal. You know, so these are the issues that we have basically.
Do you see it as a bit of an addiction as well for people, or is anyone
Yeah, I
come
mean,
across that?
I don't know that it's an addiction, more like, you know, dermal fillers with time, your body absorbs it. So it's more that you have to maintain the look.
It depends on what addiction means.
Yeah.
I mean, obviously, as you said,
You have
when
to
people have
maintain
had
it.
surgery, when they've had these, you know, they leave happy, they leave,
I think
you know, feeling good.
Yeah, I think everyone in general is addicted to
Yeah.
looking and feeling good.
Yeah.
And for a lot of people, changing your appearance makes you feel good. Like when you change your hair, for example,
Yeah.
you know, we always feel good when we do things, when we make modifications to our body. So everyone's addicted to that feeling of feeling good and making changes to themselves. Some more than others.
It's a
Unless
question.
you have, I mean, some people though, they do have, I would say that we have to be careful because we're in a Western culture, and we have a very different idea of identity and awareness.
Yep.
There's a lot of cultures that I've seen where people feel that shifting of oneself or even certain things that we would consider maybe to be like whether it's cosmetic surgery or whether it's even like cutting your hair, it's actually seen as desperation or something that's not socially wanted.
Right.
So actually there are cultures where people will either grow out their hair, they don't touch their hair, they don't touch their skin,
Yeah.
they don't do anything.
Like in Asia.
Yeah,
They have like long hair.
yeah, beauty's in the eye. of the beholder,
Different
isn't it?
type of beauty.
Different
Yeah.
cultures have
Yeah,
different-
absolutely. It's a
Like the
geographical thing,
less that you do, the more beautiful you are.
yeah.
Versus like in we're in a culture where things are consistently shifting and we feel like we have to shift with them in order to hold people's interest.
Mhm.
And I think what it comes down to is we're all afraid of not being loved. And
Yeah.
we want to guarantee that. And oftentimes we try to reflect whatever we feel is going to get us that love. And it's
Often
It's-
self-love,
yeah.
actually.
even self.
Yeah, that's the
Self-love,
biggest
because when I looked
cause.
in the mirror before I got implants, it was me. You know, my boyfriend at the time didn't think I needed it. My dad was absolutely against it. My mom, you know, she was like, whatever makes you happy, but you know, you look great. So it was me. It was me looking in the mirror with me. Yeah.
I think it's a very difficult situation when you get someone coming into your clinic, and I think this is where, you know, yes, regulation is important, but the teaching and the training of these people is very important. So, as I said, I'm a trainer. It's really important to, when someone comes in, you have to work out, what does this person want? What's their issue? Yeah? And clearly, you have to work out, have you heard of body dysmorphia?
Yeah. Oh, absolutely.
So
I
that's
have gender, yeah.
yeah, so you have to work out, like, what's happened to this person? Are they depressed? Do they have what's going on in their life? You know, are they wanting this because they want to substitute, make themselves feel good? And the issue is, you do this treatment costing, I don't know how much, depends, thousands, whatever. You know, they come back unhappy, not because of your work, which is amazing, but because of they've tried to sort of substitute. The other issue.
Have you ever turned anyone down?
Lots.
Lots, okay.
I do. Yes. Yeah. So classic example. Classic scenario. Oh, doctor, yeah, I've looked at your Instagram, love your work. You know, clearly they've come in and they've had other procedures. Why have you come to me? Why haven't you gone to your previous doctor? Oh, just want something else. You know, and then they show you a picture of what they want, someone else's facial features.
Yeah.
And you're like, you talk to them, you're like, I'm not going to achieve this with you.
Yeah.
You know, you've got a totally different face, you want a totally different, you know, appearance. And so you start asking questions and you sort of, there's a roundabout way you do it. So how, you know, what do you do for a living? You know, where do you live? How's life? You start getting you get to realise that something else is going on. Those are patients that you've got to be really careful. And so you do a sort of body dysmorphia questionnaire type thing in the history. You know, so you're trying to work out are they depressed? You know, you want to screen them. Do you know what I mean?
It's actually really sad, isn't it?
Yeah, you want to screen them because you've got to treat the right patient. You know, and so those patients that give me alarm bells, I say, I've got different strategies. I'll be like, well, go away, think about it, so it puts them off. You know, and then when they come back again, you're like, well, you know, sometimes you have to be honest with them. And some of them, if they've clearly got a mental health issue, you have to be upfront about it, and then signpost them to someone else. You know, that's really important. You know.
It's a battle for, I imagine, for practitioners, and you have to find a balance, because for someone you like Talulah, that you wanted to reflect on your outside how you felt on the inside, and you look great, and I think that, you know, when someone may come to your practice and they have lips the size of sausages, you know,
that's when you know,
and that's how they want to look.
Yeah.
Then that's the real problem. It's like, where do you draw the line that it's okay to do it to this person to reflect how she wants to look?
Absolutely.
But for you, I know that you also want to reflect how you want to look, but how you want to look is insane. It doesn't reflect how humans actually look. So it's a really fine line.
It's a massive responsibility as well, I think, for not only doctors, but people who are influencers as well. And I think that's taking it back to sort of online and social media and how this is affecting and how it's a massive surge. I want to talk about the younger generation, sort of under 18s. Now this week in Parliament, they have finally voted to put through, and I'm going to get the name right, so it's the Botox and Cosmetic Fillers Children Bill 2019 to 21.
Children?
Yes, which means that if it passes, it will be illegal for anyone under the age of 18 to get fillers.
Well, I thought it was anyone.
Well, it's not.
Well,
anyone, any age can have it.
Well, okay, so the recommendation is that, I mean, most, you know, you have insurance, and so they won't insure you for anyone under 18, all right? But it wasn't law.
No.
And that's the whole point. This is going to be law, or they want it to be a structure in law.
Because there was a big survey done, a big experiment done, where a lot of 15, 16-year-olds, they were going into surgeries and they were asking to get these procedures done and not want to have their IDs checked.
Yeah, they've done lots of sort of, they've done lots of sort of, what is it, behind the scenes kind of, you know, they've got young people to go in and see if this clinic would treat them, you know, and they would, you know. A lot of clinics often don't take date of birth, so they don't take ages, and they'll just crack on. Some will do it on the day.
You don't understand. I think at that age, you know, I got my breast implants at 19, and even then, you know, it's about informing the patient, but also I don't know if you fully understand the consequences long term of what you're doing. A child will definitely not understand. You know, like Ryan said, they make these procedures look super easy. Come to the office, 30 minutes, I'll get it done. You look amazing, and in 2 weeks, once the swelling has gone down, you'll have the image that you've always wanted. So they, you know, a lot of people make it sound that way, and it's just not. It's still a medical procedure that needs to be carried out by a professional.
Because there is no doubt that there's a difference between an 18-year-old coming through your door and a 35, 40-year-old who needs facial rejuvenation because they're aging.
Yes.
Right? We all have signs of aging. And
Would you say that there are, I don't mean to interrupt you, just, you know, I have a friend who has a medical condition. The underparts of their eyes have really sunken in
Yeah.
as a result of
Yeah.
surviving
Yeah.
some pretty horrific treatments.
Yeah.
They get under eye filler.
Filler, tear drops. Yeah.
In school, people really made fun of them quite a bit.
Yeah.
Do you think that there's some kind of gray area where if the doctor determines that, for instance, something like this, that this person will likely be undergoing for the rest of their life, partially for the protection of their under eye, because they needed a little buffer, and partially just aesthetically, if somebody's going to be undergoing this for likely the rest of their life, is there wiggle room?
Yeah, there is. Yeah, so the classic is the breast implant. You obviously it's not, the NHS doesn't pay for it, but it may pay for, breast reconstruction. Let's say if you're getting medical problems, back
You're
pain,
in a car accident or something, happened to get stabbed, sliced, there's cosmetic surgery that requires fillers
so
and
not for the
Botox.
aesthetic, but for the medical issue.
But will this prohibit people who are 15 to 18 from getting those medical treatments?
It won't.
Again, I guess that was something they'll have to think about.
You
I'm
always
sure
need
it
parental
is.
consent for
Yes.
these things when you're under the age of 18,
Yeah.
at least in any reputable place. But I'm still sure that you will find some people, just like they're willing to do back alley surgery, that will do back alley injections.
Which
so.
is our next topic.
Mm.
Online, social media ads, people who are not being able, let's say they're 16-year-olds, not being able to get fillers through a regular doctor, someone they've been in to see, so they go online, they see an ad for it.
But then why are their parents allowing them to do that?
Yeah, but did your parents know everything you were doing?
Yeah, but if I was going to get injectables and went back home, my mum or my grandma saw me with massive lips like that, or any kind of modification in my face.
Their mum might be coming as well with them.
But then that's why I said that it's something to do with the parenting.
Okay.
I think a lot of how we view ourselves is to do with how we were brought up.
Yeah, but
And-
school is brutal.
It
I mean, we have to remember,
Yeah.
my high school, some wonderful people, but children and teenagers are brutal.
I mean,
and
the word is
So that-
house of
that
influence.
also
It's
still goes-
influence, isn't it?
Yeah.
Everyone is influenced, and school is massive.
Oh,
Yeah.
it's
Then that also
it's
still
like
goes
TikTok.
back to the people that are bullying those people for having that. It goes back to that person's parenting, what they're being taught at home.
We've all got insecurities, haven't we?
Because this isn't
Yeah.
new, bullying's been around for
Yeah.
hundreds of forever, really.
Yeah, of course.
So it's then about how we then adapt to what's happening and trending now. So before we move to the frame.
I was saying there's some gateway, there's gateway fillers too, there's a lipstick, there's a lip balm, you put it on.
Oh, the tingling
The
one.
tingling one.
Oh, I love that
Irritates
one.
your lips.
I actually,
Does it cause, is it swelling? Does it cause
It
swelling?
costs well.
Yeah.
So it's just swelling.
Yeah, but there's like these
But eventually
gateways.
it's-
Yeah.
Yeah, but there'll be 1 in 1,000 who'll get like a reaction.
Yeah, but still, but once
How they
people,
work is they irritate your lips to make them to send blood to make
Yeah,
them look bigger.
but
So
you know what,
you
they
see that
actually
the
don't do
idea.
anything. Because at every photo shoot I do,
So you
they
try-
put this tingling balm on my lips. And yeah, you can feel it and you feel like you've got a cow, but then you look in the mirror and there's no difference there.
Yeah.
Do you know what I mean? So,
I mean,
it's a load of rubbish.
But it's like all these machines that people will do, sort of to lift and not
Yeah.
to have surgery and, something
Short-term
like that.
fix
Yeah,
rather than
exactly.
Yeah, like my alternative for liposuction was to have my injectables. I had fat dissolving injections put into my arm
Yeah.
Wow.
to dissolve the fat.
Okay.
And that was my alternative for lipo. I wanted something that was like non-invasive and wasn't going to
Yeah.
keep me like out of work for too long, So
And again, that's one of the things that people are going to these things
Yeah.
because you don't have the downtime.
Yeah.
I mean,
Exactly,
I
yeah.
advertise the, I suppose the sort of, lunchtime non-surgical facelift.
Yeah.
That's what you do because you can treat someone in an hour. They come in with all the signs of aging. You do the dermal fillers. They're lifted. They're all, contoured, chiseled, and they can go back to work. There's no downtime. There's no major risks.
So bring it back to sort of online and social media,
Yeah.
in particular, sort of like I mentioned before, the younger generation who are being hugely influenced by this. You've got the likes of Kylie Jenner, who in one story on her Instagram is advertising her lipsticks, and the next one is thanking her doctor for her fillers.
And then the next one, she's dissolving her fillers.
Exactly. So
Is
this
she
is,
really?
yeah,
Yeah.
did that over. They're back again now. Don't worry.
Yeah.
I was gonna say, I was
I
gonna
did
say.
last
But that sort of normalisation of procedures, is this a dangerous avenue that we're going down to actively sort of encourage people to say this is normal behaviour? Or is it something we need to be careful about?
I think humans have had an obsession with looking young forever. I mean, we can go back to the Egyptians and they used makeup, you know, so I think it's such a natural thing. You know, we want to avoid dying, we want to live forever, and looking young, who doesn't want to look young forever?
How young is too young? Because an 18-year-old, should they be worrying about their age? Or younger, sorry, a 15-year-old, should they be
No, but I think
worrying
at
about...
that age, it's about looking desirable, not looking young. And so a lot of young girls are doing it for the to be desired by boys and girls, you know?
Do you think it helps when you've got the likes of shows like Love Island?
No,
I love
they
Love
definitely
Island,
don't help, but I love it.
Oh.
my guilty pleasure. I mean, if I was single, something
But
else.
let's be real, most of us look at those shows thinking that these people are clowns and that you will never want to be them.
People think that?
You know,
I
think
don't
a lot of
think
them
so.
do. I think a lot of
I
them do. I don't know
think
anyone who
no.
seriously looks at that show and says that's my
Okay,
role
can I-
model.
Really?
No.
See, I know a
Let's hear a
million.
few things,
No,
because
no.
this is a
No.
really interesting topic,
No.
because there are both sides on this.
Absolutely.
Yeah.
You know, I got a good a privilege to have a brunch with Kim Kardashian and some individuals.
You
And-
had lunch with Kim Kardashian.
Yes, and we were talking
love
about
this.
activism and how
Name dropping.
activism is a part of a part of her work.
Yes.
And she said that one of the things that she feels good about with her show is that people see that she has all these things, Louis Vuitton, Versace, you know, she's got like this glowing skin and makeup, all these things. And that at the same time that she's still unhappy. And here's what, that she's still
But that's the
fighting,
same as
still struggling.
everyone.
And it makes people, she said what it does, it helps people who don't have very much. Say, I might not have much, but at least I'm not as fucked up as Kim Kardashian. And she says, I bring, in that way, I bring light. So it's the clown syndrome. She's very self-aware.
To perceive it. Wow.
Yeah.
Because I think, you know, a lot of people use them as a bad example. I think they're brilliant. I think you have to be incredibly smart and
Very
clever to
smart.
get where they have gotten. They have built an empire.
Yes, they
And
have.
if they can inspire people to look the way you want to look, whatever that means, without jeopardizing your health, then that's great. Because if you got fillers, you look great, you feel great, I see no downside as long as it's performed safely. But I absolutely think of some of these shows, like Big Brother, things like that, but you have to realize that they purposely put people in there that will make good TV. They don't put them there to be role models. So let's be real about that. And some of them, a lot of them, come out. For example, the last Love Island, I'm not going to name any names, but some of these girls came out. And they were beautiful on the show, and now you can see that they've overfilled everything, their fillers have migrated, they don't even notice, they don't know the term, they don't know what's happening to them, so they get more to fix it. So when I say a lot of people look at these shows and see it for entertainment value, not because they want to be them.
So I think that is a very valid point.
Yeah.
I think you're completely right. There's a lot of people who think that.
Yes.
But on the other side, I think this is where
Yeah, I think I certainly think that because a lot of them, when they come out of these shows, they are actually major influencers.
Oh, absolutely.
They are
Of
major
course.
influencers. You know, literally, they can go to your clinic and you know get
When you
treat
say
them.
major influencer, how many followers are you talking
No,
about?
no, not
numbers.
No,
A lot, but yeah, numbers.
Well, only because I only ask that because the number of eyes that are on you,
Yeah.
it's difficult. You can't even go into a Tesco.
Yeah.
There's a lot of the voyeurship.
Yeah, and we saw when Love Island came out a massive increase in aesthetic, people coming through for aesthetic, like without a doubt, you know. And so
It's massive in the UK. I know that it didn't have the same effect in the US, but for example, a show like Love Island is massive here. And you know, a lot of the comments that these people make on the show and things like that, and you can tell that their level of education makes for good TV, unfortunately.
some
But
people
that's
see it as a quick fix as
Yeah.
well.
Oh, no, of
That's
course,
a very
but
easy way.
you know, well, their behaviors and stuff, I guess, is a separate thing, but I don't think that we should be looking up to people that are chosen for entertainment for guidance as to how you need to look.
Yeah.
But you're automatically going to want to look like those people because
like,
they're the
chosen
people.
ones.
Exactly. They're on TV.
Yeah.
So if
And
I'm on TV, I should look like them. So the problem isn't so much. I don't think we can change where we are at the moment. It's just more about going forward.
The media
Yeah,
needs to
absolutely.
start picking more
Yeah.
realistic people,
Mm.
people
But
that
that's
represent
not
everyday people.
I will say they are though. Okay, I'm gonna take a hard stance here and say that the new generations are fucking over it. They're over it because their parents are my age, and my age is probably the last generation that had to memorize a phone number. You know, like cell phones were a new thing when I was in high school. Facebook was a new thing.
Yeah.
So these new generations, they're wanting to do things like, you know, the good old there's a lot more diversity on television, a lot more real bodies, a lot more. If I have to be in another free to be campaign, which please hire me, yes, I will. But I will have to say, last year I was in 4 campaigns, right? All 4 of those campaigns, same slogan: free to be. Free to be.
I am who I am.
I am who I am. This new generation is absolutely, they're done with it. There's still toxicity. There's still sexpectations, but the amount of information exchange that's happening globally, we're able to cross borders without crossing the threshold of our bedroom. We're able to walk into other lives and even do it secretly, being able to step out of our communities and explore. And yeah, maybe it's not real as in like flesh, but you know what? People who are in transphobic environments can find a space to explore.
Community online.
Yeah, they can find this, and we're melding minds and mentalities and people who have been crying out to be called individuals. In the past, our movements, we've been like, you must treat me as an individual, but then we make the mistake of homogenizing our opposition or our oppression. But now people are like, I want to be treated as an individual, and therefore I will treat you as an individual and take you on as an individual. And this new generation, I believe, will blow us out of the water. Like, we think we're progressive, maybe you think you're progressive, I think I'm pretty progressive. I think in the future, I will probably still be, people are gonna look back and be like, you did good, kid, but you could have done better. You know what I mean? I really do believe this new generation will have like, there will still be cosmetic surgeries, always. I think they'll be normalized and not demonized. But I also do think that there's going to be a lot more confidence in doing it for you and not for others.
You see that online already. I mean, you've got the likes of Lizzo, for example.
Oh, I love her.
Her body confidence online. And then you've got people like Jessie King, who she's an influencer online, who actively, she used to have an eating disorder and was told she was too fat to compete as a model and a bodybuilder. Now she's size, I think, 12 or 14, but probably not size 14 at all. But she's now been told she's too fat to do it. So, too thin to be, an activist within this world. And she has made such an impact on the generation below, where they've just gone, yeah, this is what we need to see. This is what we want to have happening. We want to see people who have been through this emotional trauma that we've been through, or we're going through at the moment, and see that there's an outcome.
Yeah.
So, when it comes to online and as influencers, is it important that we are showing a more realistic side of life?
I think reality is different for everyone. So my reality is different from absolutely everyone in here. So when you say like real body, normal body, I have been told, eat a sandwich before and things like that. So I think it's important to have a balance, and it should be about health. For example, when it comes to weight, something that might trigger you to have liposuction, for example, it has to be about health. I don't think you need to go one way or the other. We know that it's not good to be too thin for health reasons, and we know that it's not good to be overweight also for health reasons. So it might be controversial, but I am not on board with the body positivity movement when you go too much to the other end of the scale with your weight. And I know that it's a big struggle for some people, of course, to maintain. You have, you work, you have kids, maybe you don't have time or the energy or the motivation to come home and work out, or perhaps you don't have.
Are we talking about fat positivity?
I don't know if they call it fat positivity. I also don't think it's good to be extremely skinny. That is, of course, another eating disorder. That it's terrible, and you mentioned you suffer with it. And
would you say? I just want to clarify this because I'm really I'm pretty passionate about this topic, and I want to make sure because if my audience watches this, I worry that you will get absolutely consumed. I want to clarify. Are you saying that we should have more mental health support for people who are experiencing obstacles in their life, or are you saying that fat is not a good thing? Or are you saying that people should have mental health support if they're going through obstacles that don't allow them to be in the body that they feel most comfortable in? But if somebody is fat and they feel comfortable and that is what makes them feel powerful and beautiful, there's nothing wrong with that, even if you deem it to be unhealthy. If somebody chooses, okay, I'm not going to go on a tangent.
No, you know what
I'm saying? Because there's a line between there are many cultures that revere fat. They see it as a beautiful thing, and there may be some risk with having a large amount of fat on your body, just as being really skinny, right?
Course.
So there may be some risk on the other side. But for some people, they know the risk, they take the risk because it makes them feel good, right? Just like with any kind of surgery, right?
Exactly.
But they take that risk. But they shouldn't be shamed for consensually taking that risk, right? However, there are people who have mental health obstacles in their life, depression, socioeconomic boundaries that don't allow them to have access to healthy foods, inaccessible
gym.
And eating healthy is very expensive.
So are you saying that we need to provide more support to those obstacles, or are you saying that in general, if someone wants to be fat, that's not a good thing? Or if they're okay with being
support for the obstacles.
And more education needs to be provided. Not just for weight, but for example, I wish someone had maybe said to me, why do you want to get the surgery? And you know that having an asymmetry in your breast is normal. You know, maybe had I invested the 1,000 or 2,000 pounds that the surgery cost into therapy.
You need to influence people in your life saying, you're okay as you. Should you choose to or not to, I will love you.
But I wouldn't encourage someone to get implants, massive implants, which I know some women have out there that will be detrimental for their health.
This is why social media is amazing, because you have all these different viewpoints. So when people come in for these things, they've got access to be able to listen to these viewpoints, and that's the really important thing. Because before, when I started, you didn't have that. You know, people were blinded. They were one way. It was sort of I'm going to have this and not. You've got viewpoints, and that's really important.
And actually, I think, kind of bring what you were saying there, is very similar. You could sort of apply what you're saying to surgery, to people who want to be thin, people who want to be fat. If it's their choice, it's their body.
It's about having the information.
I need to clarify because it's not about fat shaming. I don't think either with surgery, injectables, or weight, if possible, weight's a bit more complicated because there's sometimes genetic factors that play into it, or conditions where you can't actually do anything about it.
But I think my take from what you're saying is like it's really important that you have the information.
Yes.
That's really
information about what? About gaining weight?
No. With any procedure, for example, with any cosmetic procedure.
So all risks are consensual. It's like if you do choose to get those massive things, as long as you know that these are the obstacles you may be experiencing, and somebody says, you know what, I'm going to do it.
And then, just like everybody who goes under the procedure knows the risks.
No,
really?
I think that people fool themselves.
You're about to be put to sleep and have knives put in your body and you think there's no risk?
But those risks are for an hour or two.
Yeah, people don't think about the lifelong.
Yeah. So,
like Pamela Anderson, she's amazing, and she talks about like the impact of surgery on it's a lifelong thing, but you don't really think that your short-term gain that you have either through career or love or community will outweigh those long-term factors.
Self-confidence.
But
that's the main one. People that have surgery for love, do they?
Well, some people do.
Unfortunately,
some people do, absolutely. In fact, there's a lot of trans women and trans men who even will get like the facial reconstructive surgery, and it can break your face.
They do break their face.
And they do it they do it because some people have done this where they're like, it's not really for me. It's that I want to have a love life. Exactly. And it's just really sad because it's like what I would love is if we could all take away any of the fear of not being loved or accepted, loved or accepted
We could
as
just
you
live
are.
ourselves.
And then it's like, if you want
yeah.
to do your journey, you do it because you're doing your journey. You're not doing it because you're afraid of ever losing me in your life, you know?
Yeah.
Right. Of course.
Yeah.
Okay, so what needs to happen then? We're sitting here and we're having this conversation as influencers, people who have a following will come to you for advice. What needs to
I think we
happen?
have more of these conversations. This is like a great conversation. We need to have more of these conversations so that people out there who are deciding on these things, like it gets into their minds. You know, it's not just kind of, oh, they just look on Instagram. They hear other thoughts.
I think
you know?
Don't be delusional when it comes to things like cosmetic surgery. Know your reasons for doing
Absolutely.
it. You know, like if it is because of your gender identity or because you know you feel insecure about something, know your reasons for doing it. Don't do it purely because you want to look like something else or someone else. Or because it's a trend.
And if there's a greater conversation, there's more avenues that you can go down to explore it further.
Yeah.
Do you see what I mean? Explore alternatives. And that's what probably isn't happening. People just see it as like, that's a quick fix. They're not exploring all the other alternatives. They're not giving it time to make that decision. The decision is not a bad one. And when you get to that point to have a decision, then you should be in a regulated setting where you should be given all the information so that you come to the best possible choice for you, for your journey.
Yeah.
I think because our focus is the impact of social media and the thing is influencers, I actually think we need to take the responsibility away from them because a lot of them, the majority of them, are not medical professionals. There is no reason why they need to know the ins and outs of medical procedures. Even the ones that they have done, they'll be explained some complications or whatever, but you cannot expect Kim Kardashian, who is not an MD, to tell you the risks of what she had done if you choose to do it. You know, we cannot hold them responsible, I think, to the extent that we want to hold them responsible, because at the end of the day, it's your choice to want to look a certain way. And yes, you might be inspired by some of these people. I think the responsibility has to be in the people that provide these procedures. They're the ones who really need to inform you on what you're having done and what the risk is and how it can harm you or benefit you. I don't know that...
One has to be careful because the person at the end, the doctor, can't be responsible for the social aspect that's driving this, you know, and that's a big issue. You know, the sort of, you know, we talked about the gender identity. These are the things that are driving people, you know, sort of the social. We know, for example, let's say in the next 6 months, let's say there's a lockdown, etc., or the economy goes down. That's going to drive a lot more people towards aesthetic procedures, especially when people lose their jobs. You know, cosmetic world doesn't go down. It's the one aspect that actually possibly goes up when there's a recession. People want to look good. People have lost their jobs. They want to look good. Yeah.
And everyone gets in debt to look good.
To
look good. Yeah.
Okay, so it's something to be aware of. Not taking. Actually, maybe there's a thing around having a bit of joint responsibility. From
Absolutely.
Better regulations.
Yeah.
Social media. It's not the be all and end all. Influencers taking that procedure.
And know your reasons for doing it. Don't be like delusional. Know why you really want to do it.
Have that support there.
Yeah.
As well.
Like my decisions were definitely not easy.
Yeah.
You know, I had to think long and hard. I had to go through so many psychiatric assessments and I had to face my family and friends every day and I had to explain my reasons for my journey.
And I love
again and again and again.
And I love what you're doing because obviously someone listening to your story would think again, do they really want to have this?
Yeah, and I think it's so important that you're speaking about it.
That's all I can do, you know, raise awareness as to what happened to me. I know it doesn't happen to everyone,
At least,
but it could happen.
At least if they go through it, you're helping them to think twice before going through it and going through with it.
Okay. All right. Well, we're going to have to leave it here for today, but thank you so much for joining us and for all of your wisdom on this subject and your opinions.
Thanks for having us.
It's been a pleasure. Thanks for joining us, and we'll be back very soon with another big question.